Parkinson's disease is a movement disorder that is chronic and progressive, meaning that the symptoms continue and worsen over time. Parkinson's disease occurs when a group of cells in an area of the brain called the substantia nigra begin to malfunction and die. These cells in the substantia nigra produce a chemical called dopamine. Dopamine is a neurotransmitter or chemical messenger that sends information to the parts of the brain that control movement and coordination. When a person has Parkinson's disease, their dopamine-producing cells begin to die and the amount of dopamine produced in the brain decreases. Messages from the brain telling the body how and when to move are therefore delivered more slowly, leaving a person incapable of initiating and controlling movements in a normal way. People with Parkinson's disease can have several different symptoms, but the most common symptoms are tremor of the hands, arms, legs, jaw, and face, rigidity or stiffness of the limbs and trunk, bradykinesia or slowness of movement, and postural instability or impaired balance and coordination. Also, as many as 1 million Americans suffer from Parkinson's. People with Parkinson's have average life expectancies compared to healthy individuals. Only in late stages of Parkinson's disease can someone die from the complications of Parkinson's. These complications include choking, pneumonia, and falls. The rate for men having Parkinson's is 91% higher than that for women. Hispanics are most likely to have this disease, followed by non-Hispanic whites, Asians, and African Americans.
One of the many proteins responsible for the onset of Parkinson's disease is the alpha-synuclein protein. While the normal function of this protein is not certain, it is speculated that it may help with the release of dopamine. Dopamine is necessary in the body to help control movement, both voluntary and involuntary. In a person affected with Parkinson's, the alpha-synuclein gene may be mutated in one of two ways. In the first case, the protein may fold improperly, causing it not to function. And secondly, there may be a duplication of the gene that codes for alpha-synuclein, causing too much protein to be made. When there's too much alpha-synuclein in the cell, it clumps, affecting neuron function and the release of dopamine by either killing dopamine in the brain or disrupting the flow of dopamine, allowing it to reach toxic levels. These clumps of alpha-synuclein are called Lewy bodies and can be very highly concentrated in the parts of the brain responsible for balance and movement. A patient diagnosed with Parkinson's disease will have to make significant lifestyle changes, including possibly becoming completely dependent on caregivers and loved ones. Also, as balance becomes impaired, safety becomes an issue. Taking preventative measures like installing handrails and electric beds in the home, as well as keeping phones accessible, can help prevent accidents before they occur.
The diagnosis of Parkinson's involves 2 steps. Doctors perform a full medical history and a neurological exam. The questions for the medical history include questions like, is the patient having trouble making hand movements like buttoning shirts? Does the patient feel stiff or slow? For the neurological exam, the doctor can ask the patient to perform small tasks. These tasks include such things as asking the patient to walk down a hall or get up from a chair. While the patient is doing this, the doctor is looking for finger tapping or tremors. The doctor also asks the patient if their vision and sensation has changed. Mental and emotional conditions are assessed as well. The doctors perform routine exams such as checking the heart and lungs. Currently, there is no screening test at this time. The current genetic test for Parkinson's was found by Dr. Justin Rubio of Melbourne's Howard Florey Institute in Australia. He created the gene sequencing chip which screens for 17 genes for Parkinson's. This screens for the known Parkinson's genes and others that could be genetic reasons for having Parkinson's. This test will eventually be able to determine the treatment that best suits the patient as well. The average onset for Parkinson's is 55. However, 10% of Parkinson's cases are in people younger than 40. No known treatment can reverse the breakdown of nerve cells that causes Parkinson's. Many people have mild effects and need no treatment for years after initial diagnosis. In worst cases, levodopa is prescribed. In serious conditions, a brain surgery called pallidotomy is effective in reducing symptoms. Also, a brain-stimulating therapy can be done. The effectiveness of the treatments varies. Deep brain stimulation therapy is not much more effective than levodopa alone. However, levodopa and other medications for Parkinson's have the wearing-off effect. This is when the duration of the medicine's effectiveness shortens over time. Also, these medications can produce involuntary movements. Sometimes levodopa can only last a few hours at a time. Scientists are trying to find substances that prevent dopamine-producing brain cells from dying. A new surgery is being tested in which healthy dopamine-producing tissue is placed inside the brain.